Mental and Emotional Health Issues Tutorial. Objective: in this lesson, you will identify types of mental and emotional health issues.
Introduction. Recently, Jane has not been the outgoing girl she used to be. She hardly eats these days and has lost a lot of weight. She stays in her room all the time. Her grades have been slipping, and she has stopped going to basketball practice. Her mom is worried about her, but doesn't think she needs to take Jane to a doctor yet. Is Jane's mom right? We usually associate the word health with physical health. When people are not suffering from any obvious physical illness, we consider them healthy. But health includes more than just our physical health. It's important to look for warning signs of mental illnesses as they are likely to go undetected. A mental health condition is a condition that affects the brain and influences the way a person thinks, feels, behaves, or relates to people or surroundings. Let's learn more about mental and emotional health issues. About mental health conditions. A man is tormented by the notion that he may injure his children due to his carelessness. He cannot leave home until he has checked and rechecked the gas and water faucets to make sure they are turned off. A woman is so anxious about germs that she washes her hands every time she touches anything handled by others. Both these people are showing symptoms of a mental health condition. Every year, about 20% of the U.S. population is affected by some form of mental health condition, and only 1/3 of this population receives the help it needs. The main reason for this is the lack of awareness about mental health conditions. Misconceptions and stereotypes may prevent some people from seeing mental health conditions as medical conditions. Either people do not realize that they need help, or when they do, they may not seek help. Some people are reluctant to seek treatment because they feel embarrassed or ashamed. Some mental health conditions are genetic. They can also be in response to prior traumatic events, stress, or situational events like a death or breakup. Mental health conditions can be sorted into eating disorders, anxiety disorders, and others, such as depression, mood disorders, conduct disorders, and schizophrenia. All mental health conditions, if not treated in time, can lead to deterioration in physical health. For example, eating conditions can cause serious heart conditions and kidney failure. Anxiety disorders can cause sleeplessness, trouble concentrating, or excessive weight gain or loss. People with severe cases may harm themselves or others. Eating disorders. Teenagers are more likely than others to be influenced by the ideal figures glamorized in the media. Many teens know little about true ideal weight and believe that dieting is a normal activity. So teens are more likely than adults to suffer from eating disorders. Extreme eating patterns, like a compulsion to eat or to avoid eating, define eating disorders. Anorexia nervosa and bulimia are two conditions that are likely to arise from an extreme desire to be thin, and often a misperception of one's own body size. Eating disorders are caused by a complex mixture of biological, behavioral, psychological, and social factors. These disorders can cause serious heart conditions and kidney failure. Many consider an eating disorder a woman's problem, but studies show that men do suffer from eating disorders. Since they are less likely to seek help, the illness can be more dangerous for them. Let's take a closer look at the types of eating disorders. Anorexia nervosa. Dion thinks he is too fat, so to lose weight, he eats very little, but he is actually underweight. He is suffering from an eating disorder called anorexia nervosa. A person with anorexia nervosa harbors an irrational fear of becoming overweight and tries fad diets, diet pills, and even starving to lose weight. Anorexia nervosa often results in malnutrition. It can lead to acidity, low blood pressure, low bone density, anemia, headaches, tiredness, irritability, and mood swings. Ignoring symptoms of anorexia nervosa can be fatal. People suffering from anorexia need help from a healthcare professional. If a friend or sibling shows symptoms of anorexia, talk to a trusted adult such as a parent, a school nurse, or a counselor.
Bulimia. Joanne is afraid of putting on weight, but at the same time, she can't control her urge to eat. She tries to maintain her weight by eating large quantities and then vomiting. She often goes through cycles of strict dieting and binge eating. Joanne is suffering from bulimia. Bulimia is characterized by binge eating and then purging the food from the body by vomiting or taking laxatives. Most people with bulimia don't gain weight, but the binging and purging causes dehydration, kidney damage, and nutrient deficiency. People suffering from bulimia may be aware that they are overeating, but are unable to control themselves. As a result, they may develop low self-esteem, depression, and sometimes suicidal thoughts. It's hard to know when people are bulimic because they may behave normally in public or may be too embarrassed to seek help.
Binge eating disorder. Have you ever overeaten your favorite food until there was no room left in your stomach for dessert? We all overeat sometimes. Binge eating, however, is an eating disorder where people cannot control their compulsion to overeat. They eat and eat, even when they are not hungry or are full. Binge eating differs from bulimia because it is not followed by purging. People with binge eating disorder can gain a lot of weight, which leads to high blood pressure, bladder problems, and high cholesterol. Binge eating can also increase risk for certain types of cancers. Like people struggling with bulimia, those struggling with binge eating disorder likely suffer from low self-esteem and depression. Counseling is beneficial and can help teach strategies for managing impulses, eating, and healthy meal planning.
Drag the tiles to the correct boxes to complete the pairs. Match each disorder to its characteristic feature. Anorexia nervosa, binge eating, or bulimia. Overeating but not purging afterwards. That's binge eating. Not eating enough is anorexia nervosa. Bulimia is overeating and purging afterwards. Yeah, got it correct.
Anxiety. Now we'll learn about when anxiety can become a mental health condition. We all experience a normal feeling of anxiety when we think something dreadful is going to happen. When this anxiety refuses to go away and makes a person extremely nervous and tense, interfering with daily life, it becomes an anxiety disorder. Anxiety disorder is a blanket term that covers several forms of intense and persistent fears, worries, and phobias. Studies say that 18% of Americans have an anxiety disorder. Anxiety disorders can be treated with medication or therapy. The choice of treatment depends on what the patient is comfortable with and the type of disorder involved. Let's look more closely at anxiety disorders.
Obsessive compulsive disorder, OCD. Julia washes her hands dozens of times a day. Each time she soaps them twice. She wants to stop but never feels clean enough. At school, Julia tries not to touch doorknobs or handrails, worrying that she may contract a serious disease. People who think and act like Julia have an obsessive compulsive disorder, or OCD. An obsession is a thought that takes over the mind, and it may lead to a compulsive behavior. OCD refers to a pattern of recurring thoughts or behaviors that prevents people from going about their day normally. People with OCD might feel an irresistible urge to do things repeatedly throughout the day.
Post traumatic stress disorder, PTSD. Post traumatic stress disorder, or PTSD, is a condition that may develop after a terrifying event that caused physical or mental harm. People who survive life threatening trauma, such as personal assaults, earthquakes, tornadoes, hurricanes, bombings, plane crashes, or military combat, are at risk for post traumatic stress disorder. Sleeplessness, numbness, nightmares, and problems concentrating are some of the symptoms of PTSD, which may arise weeks or months after the trauma. Sometimes a particular situation reminds the sufferer of the trauma, producing anxiety and unleashing these symptoms. Some people with PTSD may also feel guilty because they survived the event when others didn't.
What is Sheila suffering from? Sheila was in a terrible accident 6 months ago that left her best friend paralyzed. She still is startled by the slightest sudden noise and suffers from sleeplessness, nightmares, and numbness. She has trouble concentrating on anything for a long time and has stopped hanging out with her friends. A phobia, a panic attack, or post traumatic stress disorder? Correct.
Other mental health conditions. Other mental health conditions include mood disorders, conduct disorders, personality disorders, schizophrenia, and impulse control disorders. The most common among these are mood disorders. Mood disorders are defined by severe mood changes that interfere with a person's everyday life. Depression and bipolar disorder are two common mood disorders. Depression is a prolonged and all-encompassing feeling of sadness and a loss of interest in usual activities. A person suffering from depression may not be able to concentrate or handle everyday decisions and challenges. Bipolar disorder, also called manic depressive disorder, causes changes in a person's mood, energy level, behavior, and ability to function. A person with bipolar disorder alternates between extreme happiness, called mania, and extreme sadness. These extreme emotions may leave the person tired and unable to concentrate. They may also result in overeating and oversleeping.
Conduct disorder. Ryan has a curfew, but he defies it often and stays out late. At school, he breaks every rule. He is aggressive and bullies others. Such extreme behavior, which violates the rights of others as well as basic social rules, are symptoms of conduct disorder. This condition is more common among males than females and is more common in children and adolescents than adults. Conduct disorder shows up in social behaviors such as lying, theft, violence, aggression, and vandalism. People suffering from this disorder experience anxiety, depression, and low self-esteem. They may have problems relating to others or holding on to a job. Personality disorder. Personality is all about how a person relates to others. Most people get along well with family, friends, and new people, but for someone with a personality disorder, this is tough. Many different types of personality disorders can afflict people. Someone suffering from antisocial personality disorder would be isolated, emotionally unstable, selfish, and demanding. Symptoms of passive-aggressive personality disorder include not being able to make decisions and being overly dependent on others. People suffering from borderline personality disorder often experience troubled relationships and have poor self-esteem. They can also be violent with the people they need most. About 10% of the population suffers from a personality disorder. People with these illnesses can be treated with counseling. Sometimes medication can help too.
Joe often lies and steals, and he is very aggressive and violent. He behaves badly around others and can't concentrate on his studies. Which disorder could he be suffering from? I believe it said violent, aggressive, doesn't follow the rules. And low self-esteem would be conduct disorder. Does that fit? Joe often lies, steals, and he is very aggressive and violent. Conduct disorder. Now, theoretically, I would write that out in complete sentences. Which disorder could he be suffering from? He could be suffering from conduct disorder. Conduct disorder. Yes. Yay!
Schizophrenia. Schizophrenia is an extremely complex mental health condition in which a person loses contact with reality. This condition affects 1% of the American population. People suffering from schizophrenia have trouble telling the difference between real and imaginary events, which leads to unpredictable behavior and bad health habits. Schizophrenia's main causes may be a combination of genetic factors and structural and chemical changes in the brain. Symptoms include delusions, hallucinations, and disorganized speech. A common misconception about people with this condition is that they are violent or have multiple personalities. Not true. Most people with schizophrenia are not a threat to others. They can be treated with professional help.
Impulse control disorder. Mike is addicted to video games. Once he starts playing, he just can't stop, so much so that he forgets to eat, sleep, and meet friends. He is unable to concentrate on his studies and gets aggressive when his parents ask him to stop playing. He is always demanding money from his parents to buy more games. Mike is suffering from impulse control disorder. Impulse control disorder is characterized by the inability to resist the impulse to do something or an addiction to some activities. The main symptoms are severe urges to buy things or do things that are not important, which in turn may lead to financial problems, addiction, loss of interest in everyday routine, and seclusion.
Drag the tiles and to the correct boxes to complete the pairs. Match each mental health condition to its symptom: bipolar, conduct, personality, and schizophrenia. Tough to get along with others, aggressive and destructive actions, extreme changes in mood, loss of contact with reality. So we put schizophrenia here. We put bipolar, extreme changes in mood. Conduct disorder would be aggressive, and tough to get along with others would be personality. What do we think? We think so? Sweet! Alright, congratulations, you've completed the tutorial on mental and emotional health issues. Please note that these are serious, they are not a joking manner, and that you should reach out to a doctor, a parent, a trusted adult, a school counselor, or someone you know that can help you process any feelings you might have about these mental and emotional health issues.